Hello to everyone, we are Group 2 and for today's video, we are going to talk about acute kidney disease, chronic kidney disease, and end-stage renal disease. The first thing that we are going to discuss is acute kidney disease. What is this acute kidney disease? So, acute kidney failure occurs when your kidney suddenly, I am reiterating the word suddenly, so when your kidneys suddenly became unable to filter waste products from your blood, so pag yung kidneys natin ay nawala ng filtering ability, dangerous levels of waste may accumulate and your blood's chemical makeup may get out of balance. There are three types of AKD or acute kidney disease. Namely, pre-renal wherein nagkakaroon ng reduced blood flow sa kidneys. Another type is intrarenal, may damage na sa kidney tubules, glomerulus, and interstitium. And the last type is post-renal yun na yung obstructed na ang urine flow. Further informations will be discussed later in this video about sa types. Sa acute kidney failure or also called acute renal failure or acute kidney injury, it develops rapidly. Again, rapidly kaya siya acute. Usually in less than a few days. Usually, ang acute kidney failure are common sa mga people who are already hospitalized, particularly in critically ill people who needs intensive care. It can be fatal and requires intensive treatment. However, acute kidney failure may be reversible if you're otherwise in good health. You may recover normal or nearly normal kidney function.
So, moving on to the pathophysiology of acute kidney injury. So, in acute kidney injury, we have three types. We have the pre-renal injury, the intrarenal injury, and the post-renal injury. So, to start with the pre-renal injury, in pre-renal injury, the cause of kidney injury happens before the kidney. So, the problem is in the arteries that connects to the kidney. So, the main problem here is the decreased blood flow. So, narrowing of arteries prevents enough oxygen rich blood from reaching our kidneys. And our kidney, of course, needs enough blood flow to help filter waste and remove excess fluid. And decreased blood flow or reduced blood flow to our kidneys may injure our kidney and increase blood pressure all throughout our kidney. So, what are the causes of decreased blood flow? We have hypovolemia. It is the loss of fluid. It is the loss of fluid like water and blood, wherein we all know that water and blood is essential to keep our organ on its proper functioning. Another is decreased cardiac output. So, decreased cardiac output is when our heart can no longer pump enough blood or enough oxygen to meet the demand of the body, or specifically our organs. And we have also the liver failure. So liver failure, of course, reduces blood flow to the kidneys. We have also the decreased effective circulating volume, which is caused by these conditions. Example is congestive heart failure, wherein it is the inability of the heart to pump enough blood throughout our body, specifically into our organs. And we have also the impaired renal autoregulation. We all know that renal autoregulation is a vital hemostatic mechanism that protects the kidney from elevation in arterial pressure in the glomerular capillaries and causes injury. So in the glomerular capillaries, this is where the filtration of blood takes place. We have here the drugs that causes impaired uh, autorenal regulation. We have here the NSAIDs, which can potentially be harmful to our kidney as it disrupts the compensatory vasodilation response. Also, for the ACE inhibitors, it lowers the pressure inside the kidney, wherein enough blood pressure is needed for the kidney to remove waste and to provide a proper filtration. Same way with the cyclosporin, which plays something on the vasoconstriction of the vessels. Let us move on to the intrinsic or intrarenal injury. So in here, the causes of kidney injury happens inside the kidney. And inside the kidney, we have the glomerular. And glomerular is responsible for blood filtration. And if there's an infection or acute glomerulonephritis, or also known as damage or inflammation of the glomeruli, then it can cause an improper or abnormal blood filtration in the glomeruli. And if there's also a problem in the tubules, wherein tubules is responsible for reabsorption or and allowing waste to pass through, then it can cause abnormal reabsorption. And if the tubules has problems and unable to remove waste, then it can cause high acid, which can lead to kidney stones, and that can lead to obstruction. So also we have the vascular, and in the vascular we have here the vasculitis, and vasculitis is an autoimmune disease wherein white blood cells are attacking the glomeruli, and which can cause decreased number of glomeruli and lead also to improper and decreased uh, function, or it will affect the function of the glomeruli. So if any of these three conditions happens, it will lead to ischemia, which means there will be restricted or reduced blood flow in the some parts of the organs or in the kidney. If there are dead tissues, it might accumulate and causes obstruction as well. Also, we have sepsis, infection. So this infection is caused by these conditions, and if it will lead to sepsis or an infection in the blood, which might lead to blood clot and also causes obstruction. And we also have here the nephrotoxins, and this is the cause of the use of uh, medications that can potentially harm or damage the kidney. Like, for example, NSAIDs, ACE inhibitors, those are examples of the medications that can cause damage, or, yes, damage to the kidney. So, moving on to the post-renal. So, the post-renal, these are the causes of kidney injury after uh, the kidneys. So it might be in the urethra or in the bladder. So there are obstructions like kidney stones and blood clots that comes from the kidney and goes down, then it will lead obstruction. And same way, also prostate enlargement can cause pressure on the urethra or the passageway and can cause also obstruction.
So next is the clinical manifestations of acute kidney disease. So first, clinical manifestations is decreased urine output, but although occasionally urine output remains normal. Next is the fluid retentions. For the fluid retentions, kidney not being able to remove excess fluid from our body and occurs due to the loss also of their filtering abilities. For the shortness of breath, due to build up of fluid in our lungs, kaya siya nagkakaroon ng shortness of breath, and also yung pagbaba ng iron levels and even being anxious. So next is the fatigue, confusion, and for the weakness. The three of the those three clinical manifestations, nag-occur siya, na-experience ng patient na mayroong acute kidney disease due to cause ng anemia because their kidney are not producing the key hormone, and nagbi-build up din siya ng toxins and impurities in the blood. Kaya fatigue, confusion, and weakness na-experience ng patient. For the nausea, too much fluid in the body which can cause build up of fluid also in arms, legs, which we call edema, or in the lungs o yung pulmonary edema, acidic blood or the metabolic acidosis which can cause nausea, vomiting, drowsiness, breathlessness, kagaya nga ng nabanggit ko kanina. So for the irregular heartbeat, if yung kidney hindi nagwo-work well, more stress is put on the heart, and yung heart need magpump ng blood to the kidneys. So for the chest pain or the pressure sa clinical manifestations ng acute kidney disease, if the lining covers our heart, becomes inflamed. Kaya siya nagkakaroon ng
chest pain, and pressures. For the seizure uh, or coma in severe cases, seizures due to the etiologies seen in general populations like yung intracranial bleeding, tumors, yung dialysis ng patient, and intoxications also. That is for the clinical manifestations of the acute kidney disease.
So let's move on with the diagnostic test and procedures. So for the acute kidney disease, we have here the serum creatinine urea, BUN. It is used to measure the amount of creatinine phosphate in your blood by inserting a needle into your arm. And if they got a high level of creatinine, then it means that you have kidney problems. Next one is the serum electrolyte test, or what we call the electrolyte panel. It is a blood test to measure electrolytes in your blood by inserting a small needle in your vein. And blood will be collected into a test tube or vial. And this test usually takes less than 5 minutes. We have also here the urinary sediment. It is a non-invasive test, repeatable morphological examination. It is undertaken to identify cells, crystals, and or microorganisms. Also, the urine flow test. For this test, you will urinate into a special funnel that is connected into a measuring device. The device calculates the amount of urine, the rate of flow in seconds, and the length of time until all the urine has passed. This information evaluates how well your lower urinary tract is working. Next one is the urinalysis. It is used to detect and manage a wide range of disorders such as urinary tract infections, kidney diseases, and diabetes. Urinalysis involves checking the appearance, concentration, and the content of your urine. The last one is the ultrasound. A kidney ultrasound is a non-invasive diagnostic exam that produces images which are used to assess the size, the shape, and the location of your kidneys. It may also be used to assess the blood flow to the kidneys.
Now I will be discussing the causes of acute kidney injury, previously known as acute renal failure. So there are three types of acute kidney injury, which are pre-renal kidney injury, intrarenal, and post-renal kidney injury. So the problem in the pre-renal kidney injury is that there is decreased blood flow going into the kidneys, which may be caused by hemorrhage, GI loss, renal loss, severe burns and sepsis, which can lead to hypovolemia. And we also have here systolic heart failure or congestive heart failure, which the heart cannot pump enough blood going into the different parts of the body, which also causes reduced blood flow going into the kidneys. And we also have hypoalbuminemia, which is the condition wherein the body doesn't produce enough albumin protein responsible for keeping fluids into the blood vessels. And we also have the medications, for example, are the NSAIDs, which reduce the afferent renal vasodilation. And we also have here the ACE inhibitors and ARBs, which limit the efferent renal vasoconstriction. And the cyclosporine and iodinated contrast, which reduce the renal blood flow and GFR, or the glomerular filtration rate, resulting in the increased serum creatinine and BUN, or blood urea nitrogen. So the next one is the intrarenal, which the main problem here is that there is damage to the kidneys, glomerulus, and the interstitium, which may be caused by acute tubular necrosis, nephrotoxins, including the aminoglycosides, methotrexate, lead, ethylene glycol, and also radiocontrast dye. And we also have here the rhabdomyolysis, which is the condition wherein there is breakdown of muscle tissues, resulting in the release of muscle fiber going into the blood, which may cause harm to the kidneys. And then lastly, there is There's also glomerular diseases such as glomerulonephritis and also acute interstitial nephritis. So, for the post-renal, the main problem here is that there is obstruction in the urine flow. So, the causes may be because of kidney stones, which may block one or two of the ureter. And then, we also have benign we also have here benign hyperplasia, which can cause acute urinary retention, and we also have prostatic cancer, which can cause blockage to the urethra. And then lastly, we have the intra-abdominal tumors, which can invade the kidneys or the ureters, which can also lead to urethral obstruction. So these obstructions can cause urine retention, and it can flow back into the ureters or into the kidneys, which can cause damage to the kidneys ability or functionality. And now we have the management. So our first management would be to eliminate the underlying cause. So we need to identify which type of acute kidney injury is it, if it is pre-renal, intrarenal, or post-renal. And then we should also maintain fluid balance. This is applicable for the pre-renal kidney injury, wherein it may be caused by hypovolemia due to hemorrhage. And then we also have avoiding fluid excess. This is applicable for post-renal because, as I've said earlier, there is urine retention. And then we have, when indicated, we should also provide RRT or renal replacement therapy. We should also avoid associated risk factors, and if there is shock and infection, it should be treated immediately. And so for the nursing interventions, we should monitor the patient's vital sign and monitor for signs of complications, or monitor for complications including fluid buildup and pulmonary edema. We should also participate in the emergency treatment of fluid and electrolyte imbalances. For example, is administering intravenous fluid as ordered. We should also assess for the patient's progress and response to the treatment, and also provide physical and emotional support. And in addition, the nurse should keep the family members informed about the patient's condition, and so the patient has knowledge on the following treatments for the patient, and also for the family members to provide psychological support to the patient. And lastly, we should provide nursing care. Nursing care indicated for the primary disorder. For example, if after identifying which type of acute kidney injury is it, we know if it is, for example, caused by burns, shock, trauma, or obstruction of the urinary retention, we should provide the necessary treatment for those.
Moving on to the next kidney disease is the chronic kidney disease or CKD naman. Also called chronic kidney failure, and it involves a gradual loss of kidney function. Yung kidneys natin ay nag-filter ng waste and excess fluids from our blood, which are then matatanggal sa ating urine. Itong CKD is magkukos ng buildup of fluid sa ating katawan. In the early stages of chronic kidney disease, you might have few signs or symptoms and might not realize that you have kidney disease until the condition is lumala na. So parang tahimik siya na biglang aatake. So even i-control natin ang cause, it might not keep kidney damage from progressing to end-stage kidney failure, which is fatal without artificial filtering or dialysis or a kidney transplant.
Alright, so I will be explaining the chronic kidney disease. So as we all know, as the name implies, chronic means it takes a long time, a progression of an acute kidney injury. So that's what it means, and most of its causes is by ischemia. So most of the causes that I have searched, it says hypertension, diabetes mellitus, and untreated acute kidney injury. So ano nga ba po yung chronic kidney disease? Chronic kidney disease, it has 5 stages. First stage, pwede pa yan ma-heal, pero as it goes, stage 2, stage 3, stage 4, stage 5, we reach the end stage wherein mahirap na, kailangan na natin ng dialysis, tapos kidney transplant. So, paano nga ba tinitest yung ano? Ay, bago pala yun, explain ko po muna sa kidney natin, sa ating renal artery, kailangan po na yung dugo sa katawan is pumapasok sa kidney para po ma-filter, di ba? Tapos, kapag may mga diseases tayo sa katawan, gaya ng hypertension, tas diabetes mellitus, nagkakaroon ng ischemia, ibig sabihin, kulang yung dugo na pupunta sa kidney, at nagkakaroon ng, kulang sa oxygen yung ating kidney. Kasi, as we all know, lahat ng organs sa body, kailangan ng oxygen. So, paano nga ba nagkukos yung hypertension sa ischemia sa ating kidney? So, as we all know, hypertension is the elevated blood pressure. So, di ba po? Ganun. So, yung artery walls na papunta sa kidney, kapag meron tayong hypertension is merong increased blood pressure. Yun nga po, blood pressure, kaya pwede pong masira yung ating arterial walls. At kapag nasira yon, syempre hindi po pupunta yung dugo doon. At kapag walang dugo doon sa ating kidney, hindi siya nag-process ng maayos hindi siya nag-filter ng maayos. Tapos yung trabaho niya is, hindi na siya nagpa-function ng maayos. Tapos kapag naman po sa diabetes mellitus, alam naman po natin na cause yun ay, kung baga sa hypertension is masyadong mataas na pressure sa ating blood. Ito naman po sa diabetes mellitus is masyadong madaming glucose sa ating katawan. So yung glucose, isipin natin, sugar yan. And sugar is sticky. So kapag masyadong madaming sugar sa ating arterial walls, pwede silang mag-clump together at nagkakaroon ng blockage sa ating arterial walls, leading to what we know as ischemia. So, yung sinasabi ko po kanina, the 5 stages of CKD, natitesting po, we have a diagnostic test para po malaman natin kung anong stage nga ba ng chronic kidney disease yung ating pasyente. So, tawag dito ay GFR. So, ano nga ba po ang GFR? Ito po ay glomerular filtration rate. Yes, the GFR, ito, hindi natin alam kung paano, pero they found out a way to measure the blood na pumapasok sa ating kidney. So, sabi ko nga kanina, yung CKD is caused by konti yung blood na pumapasok sa kidney. So, ibig sabihin, kapag masyadong maliit yung GFR or yung rate ng dugo na pumapasok sa kidney, ibig sabihin, mas malala yung kanyang CKD. So, meron tayong stages. Sa stage 1 natin, pwede pa yung ma-heal, 100 yata. Basta yung normal po natin, GFR po natin is 100 to 125 ml per kilogram, something po ganon. Pero kapag po, mas lumalala yung CKD, napupunta tayo sa stage 5. Dito po stage 5 is lesser than 15 ml. So kapag yun po, ibig sabihin, delikado na. So yung treatment po na na-search ko na kailangan gawin natin sa ating pasyente para hindi po siya mamatay is dialysis. Yung dialysis pwede po yan na 3 times a week. Tapos yung kidney transplant kapag So ito po na dalawang treatment. Sabi nga nila, masyado silang mabigat para sa ating pasyente, di ba? Kasi yung dialysis is, kunwari yung kidney na niya hindi na gumagana at kailangan na niya ng parang mechanical na kidney para i-filter yung kanyang dugo. So, ganun po yung CKD. It is mostly caused by hypertension, diabetes mellitus, and untreated acute kidney injury. Yan lang po.
For the clinical manifestations of chronic kidney disease or the CKD, first is the shortness of breath also. That is due to the fluid build-up in the lungs. Next is the nausea and vomiting, kagaya din ng AKD kanina. Meron ding nausea and vomiting ang chronic kidney disease. Next is the loss of appetite dahil nga sa pagtaas ng hormones. kaya nasusuppress niya yung appetite ng patient. So next is the sleep problems and urinating more or less. These two is magka-connect sila since yung sleep problems ng patient, nag-occur yon due to yung pag-urinate yun ng time to time or every hour sa gabi. Kaya sleep problems occur or the chronic kidney disease have this kind of clinical manifestations. So next is the decrease of mental sharpness. Due to anemia, that is the result of kidney failure. Means that your brain is not getting enough oxygen, which can lead to memory problems. Yun nga, yung decreased mental sharpness, trouble with concentration, and dizziness. Next is the muscle cramps. Yung muscle cramps, build up of toxins resulting from reduced kidney function or due to mababa ang calcium levels ng patient and di nako-control yung phosphorus and nagko-contribute na siya sa muscle cramping. So next is swelling of feet and ankles. Yun nga yung dami ng fluids sa ating katawan. That's why nagkakaroon ng swelling na yung patient sa feet, sa ankles, kaya siya nagkakaroon ng ganitong clinical manifestation. So, next is the dry, itchy skin and high blood pressures. So, na-discuss sa pathophysiology na pinaka-cause ng chronic kidney disease is the hypertension. One is the hypertension. Yun nga, dahil sa pagbagsak ng kidney, hirap na siyang tumulong na mag-regulate ng blood pressure since one of the role ng kidney is to keep our blood pressure in a healthy range. So, that's why one of the cause ng chronic kidney disease, same din sa acute kidney disease, is yung hypertension. And next is the chest pain. So, yung chest pain, that is due to yung yung lining that covers our heart become inflamed. Kaya yung patient nagkakaroon na ng chest pain, hirap na din silang huminga sa yung mga patient na may kidney disease.
So we have here the diagnostic tests and procedures used in the chronic kidney disease. So the diagnostic test in the chronic kidney disease are just the same with the diagnostic test used in the acute kidney disease.
So the management for chronic kidney disease are the following. First is early detection and treatment, since these are the primary method in reducing chronic kidney disease. Next is monitoring blood pressure. Monitoring blood pressure is to detect elevation, so treatment can be started early. Next is treat hypertension appropriately and aggressively, since these are the second leading cause for chronic kidney disease. Lastly is ensure proper diagnosis and treatment of diabetes mellitus. Same with the hypertension, it is the second leading cause of chronic kidney disease. So the nursing intervention for chronic kidney disease are the following. Advise patients with diabetes to report any changes in urine appearance like odor, color, frequency, or volume to the healthcare provider. Next is teach the patient and caregiver about the diets, drugs, and follow-up care of the patient. So next is instruct the patient to avoid certain OTC drugs such as non-steroidal, anti-inflammatory drugs, and aluminum and magnesium-based laxative and antacids. Teach the patient to take daily BPs and identify the signs and symptoms of fluid overload, hyperlipemia, and other electrolyte imbalances. Educate the patient and the family the necessary diet for the patient. So this is the diet for the patient, such as the protein, sodium, potassium, and phosphate, and fluid restrictions. Educate the patient and family members the signs and symptoms of electrolyte imbalance, especially the high potassium. Educate the patient and the family that iron supplements should be taken between meals. Educate the importance of reporting any of these following: weight gain of 2 kilos or 4 pounds, increasing of blood pressure, shortness of breath, edema, increasing fatigue or weakness, confusion or lethargy, and also provide support and encouragement to the patient and the family. So in this providing support and encouragement, you should share the concern about the lifestyle changes with a chronic illness and decisions about the types of dialysis or transplantation.
So moving on to end-stage renal disease, or also called end-stage kidney disease or kidney failure. Nag-o-occur siya when chronic kidney disease, yung gradual loss kanina, reaches an advanced state. Sa end-stage renal disease, yung kidneys natin no longer work as they should para ma-meet yung needs ng katawan natin, which can lead nga to build up of dangerous levels of fluid, electrolytes, and waste. Hindi na nagfa-function yung kidneys natin for secretion, kaya siya tinawag na end stage kasi hindi na nagwo-work ang ating kidneys. With end-stage renal disease, kailangan mo na ng dialysis or kidney transplant to stay alive. But you can also choose to opt for conservative care to manage your symptoms, aiming for the best quality of life during your remaining time.
Clinical manifestations of end-stage renal disease includes fatigue, drowsiness, decreasing urination or inability to urinate, dry skin, itchy skin, headache, weight loss, nausea, bone pain, skin and nail changes where the skin is very dry and very itchy, and sometimes the nails becomes very brittle, and also easy bruising.
The management for end-stage renal disease are the following: kidney transplant, dialysis, which is specifically the hemodialysis. So this is performed 3 times a week. Hemodialysis uses a special filter called a dialyzer that functions as an artificial kidney. During treatment, blood travels through tubes into the dialyzer, which filters out waste and extra fluids. Next is the nutritional therapy. Like may specific silang diet for end-stage renal disease patient and supportive care. So for the nursing intervention for end-stage renal disease are monitor vital signs, instruct the patient on lifestyle modification, close monitoring the patient's intake and output, explain the importance of dialysis, instruct on appropriate diets, educate the signs and symptoms of end-stage renal disease or the ESRD, and have the patient verbalize the symptoms of concern. Also, provide emotional support to help patient cope with the emotional impact of ESRD.
The diagnostic tests used to confirm the end-stage renal disease includes blood tests, urine tests, MRI or CT scan, and kidney biopsy. For the blood test, it is used to measure the creatinine or urea in the blood, while for the urine test, it is used to assess the level of protein albumin presence in the body. While for the MRI or CT scan, it is used to assess the kidneys and also look for any abnormalities using imaging. While for the kidney biopsy, they remove a sample from your kidney or they remove a kidney tissue and they examine it to learn about the type of kidney disease that you have and also how much damage there is.